We are pleased to welcome Dr. Frank Moore, board-certified neurosurgeon at Englewood Hospital and Medical Center. Good to see you, doctor.
Thanks for having me.
Spine surgery. Your approach to it is, first of all, what kind of spine surgery do you do? And then let's talk about your approach to it, which is very interesting, unique, and effective. Go ahead.
Well, we do spine surgery on all parts of the cervical, thoracic, and lumbar spine. And although we're able to do spine surgery the same way as orthopedic surgeons do it, as neurosurgeons, it's been told that we approach the problem from the nerves outward, and the orthopedic people are more trained to deal from the bone towards the nerve. So we have a slightly different approach to the issue.
It's so interesting. People will say, I've said this on another show, because when I had this laminectomy down my lumbar, someone said, well, so you had that from an orthopedic surgeon? I said, nope, it was from a neurosurgeon. And so they said, well, it doesn't make a difference. It does make a difference, doesn't it?
I think it does. First of all, the neurosurgeons spend a lot more time during training dealing with nerves on a regular basis. And the most crucial part of the surgery is to protect the nerves. So it makes sense to have someone who's got a very good understanding of the nervous structure to have it done.
So when you have the sciatica problem going all the way down your leg from the nerve problem in your back, the neurosurgeon has a really good understanding as to why that's happening.
Surely does. I'm not saying that the orthopedics don't have it either, and the ones that are well trained will be excellent spine surgeons, but the majority of neurosurgeons know how to deal with nerves on a regular basis.
Now, you have this team approach, a partner.
Describe yes, we do. What we do in our practice is every case has two senior surgeons on the case. Imagine a pilot and a co-pilot on every flight. And the reason we do that is it cuts down the operating time. You've got four hands. We know each other very well. It's a bit like a ballet, if you would. And it cuts down the operating time. It cuts down the bleeding, cuts down anesthesia time.
Why bleeding?
Bleeding from surgery comes from the length of the surgery, because the muscles will ooze a little bit, or there will be bleeding from a vein. If you can cut down the time, there will be less blood loss. At Englewood Hospital, we're actually what is called a bloodless hospital. And people come to us from all over the country, from all over the world actually, to have this bloodless surgery. We have a big program of Jehovah's Witness people who come and have surgery at Englewood.
Also talk about this. When you work in a team like this, in tandem, less blood, again, the four hands that you talked about, does it have an impact on the recovery?
It does. The shorter the operative time, the faster you're going to be able to recover. You'll have less anesthesia in the body, but also when we do surgery, you have to retract the muscles. If you can retract them 30% less, it'll be that much faster for you to recover. And finally, as far as surgery, during the surgery, if there's a little moment of hesitation, you can debate and discuss it immediately with your colleague, and you know you're going to get a good answer.
But I'm curious about this. I'm going to ask you about people's apprehension about spine surgery overall in a second, but I'm curious about this. What you're saying makes sense on paper and logically, but I also have to believe that the individual surgeons and how they interact with each other is a huge part of this, because I also have to believe that egos, or lack of, and the ability to truly be a team is a huge part of this. Am I making too much of that?
No, I think you're absolutely right. And that's why, you know, you call this a partnership. I mean, at the end of the day, we want the best possible result for our patients, and we're not fighting it against each other.
Did you pick each other?
We did. Eventually,
did you find each other? What happened?
We have 5 people now, and it's been, you know, it's like a courtship. You figure out who's good, who's not, and eventually you end up working together.
And you see the results?
The results are great, yes.
So let's talk about many people who have apprehension. I'm never going to let anybody touch my back. No one's going to touch my spine.
Yeah, that's quite understandable, because for the longest time, surgical techniques were really not that great, not that well developed, and the results were not that great. And so people became very apprehensive, and they would leave spine surgery as the last resort. The issue is that if you can take care of the surgery a little earlier on in the process, you're going to get much better results. Imagine your car is running and you get a little red alarm on the dashboard telling you that something's wrong. If you fix it right there and then, it'll be a much better result than if you wait till the whole engine blows up. And that's often the kind of patients we get, people who have such bad backaches or such bad problems that by the time we get to them, it's a lot more difficult to get satisfactory results.
Talk about the difference between someone who comes to you, and because there are patients who come to you and you say, no, I'm not going to operate.
Correct.
Under what circumstance? I know every case is different, but...
Right. You know, at the end of the day, we obviously get a thorough history, a physical exam. And for a lot of us in our partnership, we've done so many cases that you do get a gestalt, you get an understanding of what the patient has gone through, and you look obviously at all the radiological studies, and you make a customized decision on each patient. You kind of realize some people probably should never have surgery. There's other issues going at hand, and if you're smart enough to pick that up, then you just tell them that there are other modalities, they should continue with physical therapy, this or that. And other people, you realize they can do physical therapy or get injected in their spine. Nothing's going to make a big difference because the problem is so mechanical, it needs a mechanical solution, and that means surgery.
Very personal. Real quick, I'm going to ask you about leadership in a second because I'm very curious about your person. I'm going to ask you right now, because you've done the Ironman.
Yes.
Triathlon, you also play soccer. Found out that you played soccer with our floor manager, Terry, in New York. Greatest leadership lesson you've learned, particularly in that operating room, is?
As far as I'm concerned, in the operating room, there are a lot of people involved. And I find that the biggest lesson I've learned is to really listen to the opinion of the people on my team. And you were talking about ego, not try to think, hey, here I am, the big honcho guy, and I know everything, but really listen to my nurse anesthetist if she's concerned about the positioning of the patient and not just forget about it. And we had a case not long ago, we listened to her, and sure enough, it may have made a big difference at the end. So listening to these team members is super important.
1 minute left. I know there was a patient that you worked on, I believe she was a female athlete?
Yes.
Real quick, 1 minute, explain that.
This was a woman who came to me. She had had surgery before. Surgery had failed, unfortunately. She was still complaining of severe back pain. She was an avid runner, and eventually we took her back to surgery, fixed what had to be done, and it was really comforting to see a few months later, I would say 18 months later, she sent me a selfie of herself doing the marathon in New York City saying, hey, Dr. Moore, here I am running the streets of New York. Thank you very much. So these are great stories. It also means that the first surgery that you do is the most important one. That's the one where you're going to get the best results.
Pretty rewarding, huh?
It is.
Yeah. Doctor, I want to thank you for making sense of spine surgery and putting it in perspective. And you did an important public service. So I want to thank you. I appreciate it. People need to ask the right questions of their doctor. Thank you, doctor.
You're very welcome.